Hi friends, are back with another session here. Here we'll discuss about MNT in diabetes, like medical nutrition therapy. MNT together with the physical exercise, weight control and implementing the self-control strategy should begin as soon as possible after diagnosis of the diabetes, and it is a cornerstone in managing diabetes during pregnancy. So we should advise the patient MNT before jumping onto the insulin or to the oral hypoglycemic agents. Here we will discuss the MNT in detail. In the MNT, we should know, like, we have to advise the patient proportion of carbohydrate, protein, fat, folate and vitamin B12, vitamin D, iodine, iron, energy, everything should be there in that nutrition therapy, but in a limited and a particular amount. Mostly, like, it should be non-starchy vegetables, less carbohydrate and the equal amount of the protein should be there in that plate, and advising a lot of hydration, water, 0 calorie drink. So we'll begin with the key components of MNT. First one is energy requirements. How much energy is required by particular BMI of patient. So calorie intake should be individualized on a pre-pregnancy weight, activity level and the gestational weight gain goals, which typically ranges in the normal weight BMI 18.5 to 24.9 to intake 30 to 34 kilocalorie per kg per day. For overweight patient BMI 25 to 29.9, it should be 25 to 29 kilocalorie per kg per day. For obese patient with a BMI 30, maximum 24 kilocalorie per kg per day, or a reduction of 30 to 30% of prior calorie intake. If she is underweight, which will be not there seen in the GDM, but still underweight less than 18.5, it should be 35 to 40 kilocalorie per kg per day. Now, carbohydrate management. Carbohydrate should be 40% of the total meal we are taking in a day. It should be mostly filled with the complex carbohydrate rather than the simple carbohydrate, because simple carbohydrate produce significant postprandial hyperglycemia, and this carbohydrate meal we have to divide into the 3 meals and 2 to 3 snacks to stabilize the blood glucose level. We have to focus on the low glycemic index foods like legumes and whole grains, vegetables, yogurts, apple. It should not include actually pineapple, because pineapple and papaya we should generally avoid in a pregnancy, particular in the first 3 months. Cabbage, cauliflower, you can avoid this if she is hypothyroid, having hypothyroid also. ADA recommendations are that pregnant women with GDM should consume a minimum quantity of 175 gram carbohydrate per day, representing 30 to 35% of the total calorie intake. And during breakfast, it should be reduced to 15 to 30 gram, taking into consideration the morning peak level of cortisol secretion, which is high in the morning. Fiber intake of at least 28 gram per day due to their positive control on postprandial glucose, and also it will help to relieve constipation. Then protein need to increase in the pregnancy to support the fetal growth. Recommendation regarding the protein and amino acid intake should vary according to the gestational age, like according to the growing needs of the fetus. Like 1.2 gram per kg per day at 16 weeks, it should be increased to 1.52 gram per kg per day at 36 weeks. Aim for 1.1 gram per kg per day of protein and or 15-20% of the total calorie intake. And the main sources should be low fat white and red meat, eggs, soya, nuts and vegetables, fish and seafoods. It should be hygienic, it should be clean before giving to the pregnant females. Fat, limit saturated and trans fats to 7%. Include the healthy fat like omega-3 fatty acids, fish, walnuts, flax seeds. Intake of 30 to 35% of the total calorie intake will be there filled by the fat. And the recommended macronutrients, which all we have already mentioned here, carbohydrate, protein and fat, that is advised by the ADA. It should be 175 gram per day according to the ADA, this carbohydrate. Protein should be 71 gram per day according to the ADA. Now fat 30 to 35% according to DDG and 20 to 35% according to IOM, and saturated fat should be less than 7% in the whole total fat. Now, micronutrients, what all the patient needs is ensure the adequate intake of folic acid. Why folic acid? To reduce the neural tube defects before conception. Before conception, for the 3 months, we should advise 5 mg per day, reducing the dose down to 0.4 to 1 mg per day starting from the 12 week of gestation. And iron should be 35 mg per day of elemental iron. Calcium should be 1000 to 1200 mg per day. Vitamin D should be 600 international units per day. Recently, a meta-analysis showed a clear relation between the administration of supplements with vitamin D and multivitamins and the reduction of the risk for preeclampsia. During pregnancy, supplements with vitamin A is contraindicated. Hydration is very important. Encourage the adequate fluid intake, mostly the water because it is having the 0 calories, and also the tea and coffee she should limit that intake 2 cups per day only, 2.5 to 3 liters of water per day. Monitoring blood glucose is also important. Maintaining the metabolic goals, like achieving metabolic goals, FBS less than 95, 1 hour postprandial glucose should be less than 140, 2 hours should be less than 120, and HbA1c less than 6.5%, average capillary blood glucose level less than 100 mg, and exercise moderate physical activity unless contraindicated, like in the placenta previa or any other high risk conditions. Unless contraindicated, she should be advised for the exercise. Aerobic exercises and a brisk walking diminish need of insulin therapy in that overweight females. Now here we will design one plate for the patient. Like in that plate, whole grain should be this much amount, like 1/4 portion of the plate only, and it should have a variety of whole grains, wheat bread, whole grain pasta, and brown rice. Limit refined grains like wheat rice and white bread, and healthy protein intake, in which choose fish, poultry, beans, nuts. Limit red meat, cheese, avoid bacons, cold cuts, and other processed meats. For water, drink water, tea, and coffee with little or no sugar. Limit milk, dairy, 1 to 2 servings per day, and juice 1 small glass per day. Avoid sugary drink. For fruits, we should advise her all the fruits, avoiding papaya and pineapple and some berries. Vegetables, more veggies, and greater the variety, it's better. Potatoes and French fries don't count. Like she should take healthy veggies only, and use the healthy oils like olive oils, canola oil for cooking on salad, and the table limit butter. Avoid trans fat. Thank you.